that empowerment to make those choices, that fosters autonomy, and that is compassionate care. So whenever there can be a choice and whenever they can have a voice in the decision making, I think we need to empower them to do that.
Welcome to the Misfit Behaviorists Podcast. Join your hosts, Audra Jensen and Caitlin Beltran, here to bring you evidence-based strategies with a student-centered focus. Let's get started.
Hey everybody, welcome back to the Misfit Behaviorists Podcast. Before we dive in, just a quick reminder to follow us on Instagram at the Misfit Behaviorists Podcast. Also join our Facebook group, same name, Misfit Behaviorists. And in the Facebook group, we try to drop some freebies that align with each week's topic. So we'll give you a heads up on that in our socials. But Audra, I'm going to turn it over to you. What are we talking about this week?
So I was thinking last week about the evolution of ABA over the years that I've been involved in it and how it's changed and morphed and improved. And I wanted to talk about what I would like to call compassionate care ABA, is kind of the transition of ABA in kind of the old kind of hard-nosed, you're going to do something ABA, into more of the research base, but still much more responsive to our students and our learners, and a compassionate vein of ABA, and how it still works really well together. And so I want to talk about compassionate care ABA and how that is bringing forth the client dignity and collaboration, and all of that still promotes behavior change and a supportive, positive learning environment. So that's what I want to talk about today. What do you think?
I love that so much, and I feel like it is just as important, if not more so, than all of the technical aspects of ABA. So I love that we're going to dive into this topic.
Right. And so compassionate care kind of translates into our everyday practices with some key strategies that I was thinking about. So I thought of 4 different ways that we can promote compassionate care in ABA. And the first one I thought about to create this kind of positive learning experience was to build learner rapport. And I think about early ABA, when I was doing like 25 years ago when my son was little, it was very much about these are the expectations, these are the rules. In fact, we did a lot of these are the rules and you follow the rules. And there wasn't a lot of teaching of understanding and where he was in the process and where his understanding was. He didn't come with a lot of trauma, and a lot of the kids that we have today do come with a lot of trauma. And I think it's really important that we figure out how to deal with that as well. And that comes a lot with building that learner rapport. And so I've dealt with a lot of staff over the years and taught them, look, the number one thing for you is for you to become the reinforcer. The most important thing for you to do is to become the thing that the child wants to be with. So in the beginning, all you're going to be doing is pairing yourself with whatever it is that they're interested in. Don't worry about the goals. Don't worry about the data. In the very beginning, you're just building yourself as the reinforcer. So if they're interested in playing with a piece of string, get down there and play with the piece of string. It's totally fine. And so you're building that rapport with them. So you're emphasizing that positive reinforcement. You're building trust, because a lot of our students come in with, they have a lot of trust issues. And so you want to build that positive trust, understanding their preferences, beef up that positive reinforcement opportunities, catch them being awesome. So that's the first thing, I think, really building that rapport from the beginning.
Yeah, for sure. And I think, like you mentioned, we all learned how to pair with our learners, whether we learned in practice or in textbook. But I do feel like somewhere along the way, sometimes that has a bad rap nowadays, where it's, oh, you're just pairing with them so that you can turn around and make them do something or something like that. And I don't know when that just became such a negative connotation. If you're taking a child to a counselor, the first couple of sessions, that counselor is just going to get to know the child. They're not going to hit them with some heavy probing questions about why they're there. So I don't see why it's so different and seen as a bad thing in ABA, because like you said, our whole goal is just to get this child to like us, just to get them comfortable with us and near us. And that means so many different things for so many different learners. I have a learner that I could sit and talk about Minecraft with for the first hour I meet them, or I have a learner that I'm thinking of, a little girl who came to us so behind in so many ways. She had never been to school. She had never left her house much. She's nonverbal, autistic child. And I spent the whole first 2 hours just following her around and like dropping like little gummies next to her, because she wouldn't even take them from me, her favorite food. I was just showing her, like, I don't want anything from you. I just want to show you good things. And so hours and days and weeks later, this child was able to look at me and indicate that she wanted something and maybe do something that was appropriate, put her coat on to go outside or something first. And I also wanted to mention, I think this gets overlooked in the second stage once we've built the relationship. Sorry, I'm doing a lot of talking at once here.
Do it.
I think sometimes this gets overlooked when we move from the pairing phase. Once the child has accepted us and once the child likes us, we're seen as an agent of reinforcement. We don't have to stop building that relationship. And I don't think many people do this on purpose, but sometimes it's okay. They're up to 5 tokens and 10 demands each. But I'm always a huge advocate of like, right, that's great. And every once in a while, just give them a freebie. And people look at you like, no, they're up to 5 tokens and 10 demands each. And it's right. And every once in a while, give them a freebie because in real life, that's what you get. And you still want them to remember on their worst day, this person is still someone who sometimes gives me something just for showing up, just for nothing.
That's exactly what I was going to point out is that you don't just build rapport in the beginning, is that you need to continue that throughout the time. And you're going to infuse yourself as that positive person in their life throughout everything. And you may find that a learner, you build that rapport and they start developing skills and stuff. And then all of a sudden there's pushback and stuff. Then take everything away again. Take all the data away, put all the skill sets away and go back to the floor and engage with them and build that rapport again. Because maybe something's happening in their life that you don't know about. Maybe they've hit a wall in the learning or whatever. Maybe they just need a break. I mean, don't we all just need a break sometimes?
Meet them where they are every single day. Not meet with them where they are yesterday or this morning. Meet them where they are right now.
I learned a lot of this from a number of years ago, back when going way back, when I got my BCBA, it was 2007, and it was up in University of Washington. And I did my student teaching under a fantastic gal that was doing, I think it was a birth to 3, if I remember. So many years ago, I can't even remember. She was doing a birth to 3. It was an autism program, but she came from a floor time background. And so she wasn't a BCBA, the behavioral background, but she was a floor time. And I came in with this BCBA behavior background. We worked really well together. And a few years later, when I had opened up my ABA clinic and she moved down to where I was living, she contacted me and I brought her in, and she actually ended up getting her BCBA, but she had that floor time background. And so I learned so much from her about that ability, that need to connect with a child down on the floor. I mean, getting that pivotal response, that connection is just so important. So that was the number one thing I think I thought about as I thought about compassionate care, because I think it's the most important thing as we go through these other ones, that it's just building that rapport, not only in the beginning, but throughout the whole process. And then, so the number 2 thing I think about builds from that is looking at antecedent-based interventions. Everything that you can do beforehand. So focusing on triggers and setting events and everything that you can do proactively that prevent the behaviors from actually happening. Because what you're doing then, you're teaching those replacement behaviors, you're preventing the challenging behavior, you're building that positive experience at school and at home, having those social feelings, social experiences, feelings of safety and inclusion while being at school. All of that stuff is going to promote that feeling of trust and safety that the child needs as well.
Absolutely. And I think one of my favorite strategies to build into any behavior plan is that antecedent strategy of non-contingent reinforcement, which I guess technically is a reinforcement-based strategy, but we're using it antecedently. This isn't a technical episode.
No, it's not.
So
we never will be.
We never will be. So just even whether you're setting that timer every 5 minutes, every 25 minutes on a variable interval of 10 minutes, making sure you're catching them being good, like you said. And the timers are our friends because otherwise we forget. And then we're getting the skill data and we're like, yeah, no, I'm always giving them freebies. I'm always catching them being good. But that timer is going to make us accountable for that strategy the way that another strategy is going to be accountable for. Like you're definitely going to give the token because the token's right in front of you, or you're definitely going to flip the card because the card is tangible. But the praise and the intangible things like that should be linked, I think, always to some kind of visual or timer for us, not necessarily for the student. And literally whatever, if you're lucky enough to have found the function or one of them already, if it's attention, if it's an edible, if it's something, like put that on the time schedule and they don't have to do anything for it. And you can increase it, of course, because as the learner gains skills, you want to emulate the real world, but keep that in, even if it's like a really infrequent schedule.
Right. I love that. And I love the whole idea of just looking at your environment and everything that you can do to prevent those behaviors from happening. It's so much easier to prevent a behavior and create a positive learning environment than it is to what is the old phrase? It's easier to ask for forgiveness than permission. We kind of word it's easier to prevent a behavior than to try to undo a behavior that's happened.
Yes.
And so I think the better we are at preventing those behaviors and putting those supports in place preventatively is compassionate care. I mean, it really is. We
Absolutely.
don't want them to have those negative. I mean, nobody wants to be in crisis. Nobody likes those feelings. We've all been in crisis when students are in crisis. Those are horrible feelings. So we don't want that for ourselves. And we know that these little tiny humans don't want that either. And so that's why those concepts are really important.
I'm thinking of that one episode where you showed us that kind of scale or like that mountain, the behavior mountain, and at the peak, right? And if you can avoid getting to that peak,
Yeah.
even if you can avoid like out of a 10, if they're getting to an 8 or a 7 or a 6 instead of a 9 or 10, that's so huge. And that way to do that sometimes is just putting that non-contingent reinforcement. What are they looking for? If it's attention, flood them with attention. If it's tangibles, flood them with tangibles. Make it so that by the time they're like about to do that old behavior that gets them that thing, they're like, meh, I know it's coming soon anyway.
Yeah.
Make it irrelevant, make it inefficient, make it just so much easier to be flooded with the things that they want that they're not even thinking of ways to engage in that problem behavior to get that.
That also leads really well into number 3, which I think is that giving them choice, skill acquisition, and behavior management with choice. So offer options. Providing students with that choice, not only in do you want the red pencil or the blue pencil, but give them choice in goal setting. This isn't something we did 25 years ago, but as early as possible as they can be engaged in what they want to work on, what's important to them, giving them that empowerment to make those choices. That fosters autonomy, and that is compassionate care. So whenever there can be a choice and whenever they can have a voice in the decision making, I think we need to empower them to do that. As they get older and their ability to make those choices and to stand up for themselves in certain situations as our world is crazy, I think that's really important to give them that power and gives them that confidence to do so. So that was number 3 I thought about, is giving them choice.
I just love, love, love providing choice as an intervention. And again, I think it's something that gets a little overlooked because it's like easy to think, yeah, I do that sometimes. I ask them if they want to sit in the side or if they want to sit with me. But like you said, just like peppering it into so many different aspects, even just like making a visual for your staff or yourself, list 25 choices you can offer that day and literally think about them beforehand. So seat, pencil, task, which staff to work with, which, whatever. And then sometimes you get the pushback, like can't choose everything, right? But if it's on their menu of 25 choices that day, then they can, right? Because it's a controlled choice. They're still listening to me. I'm just giving them some autonomy in the process and then start crossing them off. And then maybe the next day is like still 25 choices, but it's in different areas. And maybe you're keeping the learner on their toes that way. And I always think of this workshop I went to like forever ago. And I think it was Peter Gerhardt, but I'm not sure. But he talked about this study, I know, of choices. And as like a typical adult person, supposedly there's some sort of statistic or research that like you make whatever 364,000 choices in a day. I mean, you could argue it's like infinite because should you go to work? Should you get coffee? What kind of coffee? Exponential choices. And as a child, adolescent, or adult with a severe disability, on average, they make like 8 choices a day if they're lucky. Nobody's asking them all these things because it's like, get your shoes, get your coat, get your car. I think about it with my own son, a typically developing 7-year-old. Like sometimes I'm like, oh yeah, do you want to wear this or that? Because like just trying to give him some choice. Of course, he speaks up when it's something he really wants, but so much of his schedule is just dictated for him because he's a child. So just putting yourself through that lens and thinking about it that way, I think has always shifted how I thought about it going forward and how important that choice is. And you can find a choice anywhere in any situation.
I love that so much. I don't think we realize how important that concept is. The fact that we make so many choices for ourselves, and yet we pull so many choices away from students and learners over, and we think they're kids. We need to make those choices for them. But as my son has gotten older, some of the stuff that he never wants to wear a coat. And I always made him wear a coat. And now I'm like, why don't you wear a coat? And he's, because I'm always hot. I was like, when he was little, why didn't I? Okay, well, if he wants to be cold, I didn't realize he was hot, but little things like that. If the student doesn't want to wear a coat outside, they can be cold if they don't want to. I mean, so just giving them that autonomy, that choice making, I think is really important. And then thinking about those goal settings, have them involved in as soon as they can be making the decisions of what they're working on. In a clinical setting, we're able to do this more because we're working on kind of the whole child and in a home environment and goals throughout their whole lives. I think they're able to have a lot more say in that, which I really love. But even school with IEP goals and stuff, if you have a student who can communicate and you're working on their IEP, why don't you sit them down and say, hey, I was thinking about working on this with you this year. What do you think? I think it's great to do. Let them have some voice on that.
Right, absolutely, 100%.
So the fourth thing I thought about was celebrating effort and growth over just mastery of goals. And I've seen over the years, a lot of goals either get transferred to the next year, they haven't been making progress, or they're too lofty and we've passed these goals by. And really, we want to see effort and growth, and the goal itself, we want to really manipulate so that the student is showing that progress. I mean, the goal is something on a page. It represents what the student is learning. And I think we need to celebrate more of that effort and where they're coming from. And the celebration year over year of their changes, they're developing differently. Some years they're going to master a lot more goals than other years. And so just watching that we're not just focused on a goal on a paper, but we're really looking at that learner and the progress that they're making and the effort they're making, where they are in their life. And maybe they're going through maybe mom died, something like that. And so their effort's going to be, they're going to struggle more that year, or whatever it is. So just really celebrating that effort and growth over the year, and celebrating that stuff in front of other students, their effort, their growth, whatever, in front of the students.
I love that. We started doing in one of my classrooms this year, like sending certificates home as they acquire like a set number of words or numbers. And I guess technically that is a skill. So we're rewarding both effort and the progress here, but you get the idea. And so actually just printing out a little certificate, oh, so-and-so mastered her next 10 sight words or something, because I think sometimes we get caught up in like the adult side of it, like the IEP, like we can check off another goal and we'll talk about this with mom and dad at the meeting. But literally just like having this child like take that certificate home, even though they might not fully understand it, depending on your learner, like something at home now is celebrated for them. Whereas maybe their brother or sister is star student or gets to do show and tell all the time. Something for them that gets a conversation piece at the dinner table. Look what so-and-so learned. Look how good so-and-so's doing with addition or sight words. And it's like a tangible piece to it, where for a child who might not be talking about that, or who might not be recognized on the loudspeaker as much or something like that.
You can also, I love the idea of certificates. I've done that over the years, and make them not just skill-based, but effort-based. I was a really kind person today, or I put forth my best effort at this today, and making it growth mindset stuff. I've had hanging up around the room sets of stickers, and the stickers have something that say on them, like, I was kind, I did my best and stuff. And we just rip them off. Wow, you did such a good job right there. Cool. And then they're wearing it right there in front of their little friends. And I got a sticker today. And I don't know why do kids like stickers, but they love stickers. Something about
it goes through the sticker phase.
So those were my kind of 4 thoughts about compassionate care. And compassionate care isn't just about being nice. It's really about applying the science of behavior analysis ethically and effectively. So compassionate care represents that positive evolution over the course of the years that I've seen it happening. It doesn't replace ABA. ABA still has some of the most robust research to promote student progress on goals, improvement on cognitive skills, integration into social interactions and society. So it really is just our shift of how are we doing it in such a way to really be responsive to our students, our learners, and where they are. Plus, it's so much more fun to build this sort of rapport with our students. And it's okay to put the data aside and the goals aside and to get down and just roll around with your kids, because who doesn't want to be a 5-year-old every couple of days?
And I'm glad you said it that way. We're not trading one for the other, right? We're still doing ABA, and sometimes that gets fuzzy, like ABA bad, compassion good. Like, I'm practicing very researched, evidence-based ABA every day, but as you mentioned, trying to learn how to become more trauma-informed and more compassionate care focused, so that I'm infusing it into my ABA practices. And it's just that my ABA practices are hopefully becoming more compassionate and more treating everybody around with dignity and respect a little bit more the more that I learn and grow. But I'm not throwing anything out the window. I'm just, taking what I have and hopefully making it better, hopefully making it even more productive and more efficient.
I can see the results of that as I've seen so many kids from very little over the 20 years. And I've tried to really practice compassionate care over the years without knowing that's what I was doing. But I mean, like my son, he's autistic, but he is the nicest guy. I mean, he really is a nice person. And I'm looking at all the other they're now adults and they're just really nice people. And I think that's partly because we were really responsive to who they were. And it was really important that we weren't just getting the skills down, that we were really getting that environment of rapport and building a relationship. I still have old clients who are now adults that are Facebook messaging me and stuff and tell me about their jobs and stuff. It's really cool. So yeah, compassionate care, it builds with ABA. ABA is really that science of behavior, but it works compassionately, and that's what we want for all of our peoples. So yeah, that's what I want to talk about today.
And I just wanted to add, we didn't talk too much about in the heat of the moment, like during a behavior episode. And sometimes that is when it's most important. Yes, we're following the plan, we're doing all the things, we're trying not to reinforce the behavior too much, but I think there comes a fine line between reinforcing the behavior. No, that's not what I'm doing, but I'm responding to the behavior with compassion. That old school, just ignore, turn your back is out the window. And for a long time, I was saying ignore the behavior, but not the person. But everyone would say, okay, so I ignored it. And I'm like, okay, if it's so misperceived, why am I still using this word? I'm just going to try not to use the word ignore. I'm just going to say, don't give that verbal attention. Maybe that's what I say instead. Instead, I can give the child verbal attention and say, I see you're having a rough time. Your choices are this and this. Lower my voice, speak with them, just all those things that hopefully we've been doing the whole time, but just becoming more attuned to. And I feel like since I've really made a conscious effort to push that even harder and really make that my primary approach, I can see my relationships with these kids getting better, and I can see them becoming more trustful of me quicker.
I think that's also remembering afterwards, after a crisis, to go back to the child, to make sure you're building that relationship afterwards, repairing that. Because when you're in a crisis, and sometimes we are in really difficult situations, and we are in crisis as well, and it damages the relationship, to make sure after the crisis is over and after some time has passed, you go and you rebuild that. You put your arm back around, you play with the string again, whatever it is, to build that relationship back together.
Right, especially if you're dealing with a kid who it's like your moment to moment. That's in the past. They probably didn't get to go outside. They probably didn't get the reward. That's all well and good. I'm not saying they should rainbows and throw cupcakes at them, but right, they're still a human being, and I can still turn to them and be like, so what do you got planned this weekend? Or if they can't have a conversation, just look at them and go, oh, that was scary for a minute. It got very loud. I'm glad it's quiet. Can I get you some water? Like just anything, like just a conversation, just you seeing them as a human being.
And validating what they're feeling and what they're saying. I mean, many times I put my arm around somebody, hey, you were feeling really scared a minute ago, weren't you? You were feeling really angry. I could feel your anger, and just labeling that, because they have these big emotions. They may not be able to label or understand where they're coming from or what they are. And so I think it's really important that we do that.
I've started to say in my follow-up now, instead of just saying, this was all good, next time let's try this, I'm like, wow, just like you said, I'll start by saying, I noticed you were like really upset, and I just want to make sure, what can I do better next time? Was I too close? Was I too far? Next time, do you want me to turn around? And I've had a couple of kids look at you like, huh? But after a while, they'll say something, and you know what? Maybe they'll say, oh, you just had to raise your hand, and next time I do that. And it didn't necessarily work. But I think that we're getting in the right direction sometimes, where it's not foolproof, but I think it's still giving them a voice, and it's still teaching them that, okay, but if you decide to give me the answer that does work in the moment next time, I'm going to listen, I'm going to do it.
Yeah, I really like that. I'm going to use that. Cool. That's all I have for today's episode.
All right, awesome. So I love that we talked about compassionate care. I think we touched on just 4 large overviews, but definitely hit us up on Instagram and the Facebook group and let us know what you think and how you guys are practicing this in your routines. Next week, we are going to talk about some more specific, like back to basics, behavior 101, strategies to just pull out when it seems like nothing else is working. So join us then, and we'll see you next week.
All right, see you then.
Thanks for listening to the Misfit Behaviorists, and be sure to tune in next week for more tips and tricks. Don't forget to subscribe so you don't miss an episode.